Hi, everyone. Welcome to this community chats of September 5th, 2024. This is Sandra Arevalo, and I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. We bring you these education sessions with many different health topics and resources for our community in Rockland County, New York. And today, we're going to be talking about a very requested topic by our community. Of course, we want to learn more about schizophrenia and what it is and how it presents and how we can help people, either loved ones or other people in our community who unfortunately have to suffer from this disease. So with us today, our subject matter expert is Sean Wallman, and he's going to be doing a presentation about this program called HOPE. And at this point, I'm just going to ask you, Sean, to tell us a little bit about yourself and what you do and how did you start working with schizophrenia? Because I know it's not an easy field.
Yeah. So for my background, I'm a social worker. I've been a practicing social worker probably for about 8, 9 years at this point. And for a lot of my career as a social worker, I was working with people struggling with mental health, people looking for more independent housing in the community, with some support to help manage their mental health, in addition to living an everyday life in the community, whether it's going to work, school, hanging out. Um, I came into this role. I've been doing this for about 5 years now as sort of a community educator, if you will. Um, so I'm a part of Johnson and Johnson's medical team, and as a part of this team, there's a team of counselors, therapists, and social workers who do a lot of education at various different mental health programs that's serving people that might be struggling with mental health, including schizophrenia. In addition to that, I'm often invited into programs looking to have guest presentations and do more education and support initiatives for their participants. So I do a lot of like one-on-one or communities sort of chats with people that might have personal experience with schizophrenia or other mental health situations. During these conversations, I could speak with family members, but also with the clients themselves. And we talk a lot about important topics such as being an active partner, um, utilizing your treatment team and your support network, going to appointments, um, thinking about your life, personal, and overall health goals. We get a lot of really good feedback from people, and I've personally doing this work primarily with people struggling with schizophrenia. There is certainly hope. So we love that our presentations are called hope presentations because there is hope. Medications and support has advanced over decades of time. And of course, there's more work to be done. There's more education, there's more advancements to be made. But I really want to make it very clear and highlight that even if somebody out there, somebody that you might personally know or be connected with or love, might be struggling with schizophrenia, there is certainly a long and strong road for them where they certainly have the capabilities to accomplish many of their personal goals.
Mm-hmm. Well, thank you so much. And thank you for the wonderful work that you do to actually help educate the public on these topics, because they're not easy topics. Not a lot of people have a lot of knowledge about it. And, hopefully a case like that never presents itself in our lives. But if it is, it's good to have that background information, and certainly even more when you have someone in your life with schizophrenia. So thank you so much for doing that, because it's a very, very important work that you're doing for our community.
Thank you, of course.
And we're ready for your presentation whenever you want to start.
Okay. So this presentation is called Taking Steps Forward, Managing Your Recovery Journey. I really want to invite anybody here today to interject either verbally, you can have me pause, you can write in the chat. It doesn't have to be a completely me talking presentation. I love to invite discussions. If there's any questions, I will certainly clarify. Or, you know, if anybody wants to wait until the end, I will certainly allow some time for a Q&A just so we can advance the conversation. So to get started, we use the term recovery journey a lot. And that's something that I want to start out and sort of discuss in the beginning. So I want people, you know, think about in your mind as it relates to recovery. Certain things might come to mind. We might think about recovery from a stressful moment. We might think of recovery from an injury of some sort. Say somebody trips, falls, hurts their arm, maybe sprains an ankle. There certainly is a recovery process around that. Some people might go to PT, OT, do exercises, strengthen themselves. Sometimes people think about recovery as it relates to the use of drugs and alcohol. And I feel like at times people forget that recovery around mental health is also really important. So pretty much the nature of the recovery journey, that's how I want to wrap our minds around recovery. Recovery is an ongoing process that many individuals work on throughout their life. Some people say, I've heard that it's not a single outcome. Recovery depends on what our goals might be. Recovery depends on our ambitions, what we might be experiencing, symptoms, whether it might be experiencing symptoms of schizophrenia or something else. I think that holds true. Each person's recovery experience is unique. This third one is also, I think, very important. Recovery is more than just managing symptoms and includes working towards goals and finding meaning. And when I see this, I think about there's people out there that might be struggling with schizophrenia or a related diagnosis. And people are searching for possibly like that one medication that would help with everything. But there's there's not necessarily a one size fits all medication for any kind of ailment that we might be experiencing. That's why it's so important. Even though medication is often considered a foundational element of recovery and progress, certainly around schizophrenia, if somebody is even they find a great medication regimen that works for them, but that same person might feel better, but then they stay home and they are surrounded by their four walls, not leaving the house, not really doing anything that they want to do with their life. I don't like, is that also recovery? So I really think there's this idea around the importance of medication, but there's also everything else, all other supportive treatments in our lives, finding hope, finding meaning, finding goals are really what we all should be aspiring to do. Also, lastly, work with your treatment team to identify a personalized plan that works for you. We'll actually expand a little bit about this idea of a treatment team in a little bit. Managing your recovery journey. We often break down this idea around managing our mental health or recovery into three areas: understanding your diagnosis, knowing your symptoms, and then working with your treatment team. Again, I do guest presentations in the community, and sometimes I hear from people when we're talking about mental health and other similar topics. Some people don't really know that they can ask their doctor more about their diagnosis. People don't know that they can ask their doctor, "Doc, you identify that you believe that I have a diagnosis of schizophrenia. I hear you, but can you go into more detail? Could you explain it a different way? Could you say it again? Could you help me understand? I think that's really important. You know, we'll also talk about this concept in a moment, but even if somebody has a diagnosis of whatever, whether it's schizophrenia or something else, that might be one aspect of somebody's life. That person could be a parent, a sister, a sibling, a friend, have hobbies, work, like to listen to music, like to go on walks, has favorite foods, likes doing things. And then in addition to that, they might have a diagnosis of, say, schizophrenia, in which they might take medication and they might be very mindful of it, but it's just one aspect of somebody's overall life. And I think that's important that people don't forget that. We're so much more than our diagnosis. Similarly, with understanding your diagnosis, also knowing your symptoms. We'll break down some symptoms of schizophrenia specifically, but just all in all, not all people living with schizophrenia might present with the same symptoms as somebody else. There's different ways that schizophrenia manifests or somebody might experience. So it's important to be able to reflect and know what your symptoms are, just in case anything would rise back up, or if the symptoms intensify in any way. That's a sign that I should check in with myself. I should check in with my family. I should check in with my treatment team. And again, working with your treatment team. It's not only just a doctor in many cases. There may be other people in our lives that might be able to help support us around living with schizophrenia and managing the recovery journey. Any questions? I'll let anybody interject before we continue.
No questions right now.
Okay, all right, great. So this is a brief overview of schizophrenia. So according to the data, schizophrenia affects approximately 2.5 million adults in the US. Schizophrenia is a lifelong disease. There's no cure, but is treatable. And there certainly is hope. Again, I'm going to highlight that again. I personally have spoken with people that have lived with schizophrenia, and they've expressed to me how much progress they have made, whatever their situation might be. Maybe at one point they were in the hospital because the symptoms were very intense, but today, a year or two later, they're connected with family. They have I mean, the list goes on, just like anybody else. Long-term antipsychotic treatment, such as antipsychotic medication, is a common part of somebody's schizophrenia journey. While certainly not everybody might want to take medication as part of their recovery journey, it's certainly a foundational element, and it's very helpful. And the medication advancements have developed much over the last decades. So if you're thinking about medications that may have existed 30 years ago, or you've seen a movie or a TV show or anything like that, there are definitely modern medications that are very, very helpful. In addition, approximately half of the people living with schizophrenia also have a co-occurring mental health or behavioral health disorder. So schizophrenia, there's a lot of co-occurring sides of it. For example, somebody might want to find a doctor, take medication, but there might be a struggle or a journey in order to get there. But they might self-medicate with drugs and alcohol, because it might certainly be easier to go to the liquor store than to wait 2 weeks for a doctor's appointment. So that might be an aspect of it, and something that in the treatment and mental health community, there's also a lot of work, and there's certainly programs around the community that helps manage both areas. Here, I think is important. It is a breakdown to help us understand schizophrenia a little bit more. Schizophrenia is a mental health condition that affects how a person thinks, feels, and interacts with the world. We often break symptoms down into 3 categories: positive symptoms, negative symptoms, and cognitive symptoms. By positive, we don't mean like a pro or something that's good. What positive means, it's the existence of something being present. So hallucinations, delusions, difficulty thinking or speaking. So hallucinations, people with schizophrenia, it's very common for people to hear voices. The voices might not be something that we hear, or possibly see something that is not there, which to anybody around that person might be very frightening or confusing, because it is very real to that person, even though it might not actually exist. So the existence of hearing voices, sometimes there's multiple voices of different people, different like shouting, or like parts of the voices, that makes really things difficult to manifest and focus on. But there's also negative symptoms, and a lot of times when I'm speaking with people living with schizophrenia, there's still questions around what negative symptoms means. It's not always talked about in the zeitgeist, but it's certainly true. What negative symptoms, it means something that's not there, the absence of something. Flat affect means sort of emotion. So somebody living with schizophrenia might be, imagine sitting on a bench, for example, and somebody might walk past that person and observe that person, and they're not necessarily happy, they're not necessarily sad, there's just flat sort of nature, like the absence of that spikes of emotion that other people might experience when they're feeling happy or they're feeling sad. So I do have a question in the chat. Thank you. So Maria asks, how can I identify symptoms if I am not living with the person? That's a good question. It's certainly helpful to have physical presence in order to interact and observe. But if you're talking on the phone, for example, if that's sort of the area that you're leaning towards, Maria, you might hear some of the, say, positive symptoms or delusion. So I'll just take it back, just a personal experience. So in my previous job, before doing this, I vividly remember working with somebody who strongly believed that he was related to somebody who was famous, and that wasn't the case. And that was very important to that person. Sometimes over the phone, if I were to connect to him, that would come up in conversation, just like how it might come up in person when we interacted in person. So certain signs of that, unrealistic expectations. I'm just tossing out some areas that might be common, but it's not all encompassing. Believing that you might be above, like closer to like a president or a god or something like that. Hearing certain those conversations are maybe some things that we could look out for. Something that I will say though, it's fantastic to have family that is, you're helpful to your loved ones who might be experiencing something, but and our eyes and ears are very important, but I always like to say it's important to, I guess, defer or include a treatment team who are professionals, professional staff that might be able to help with the identifying symptoms and the treatment journey. But it is really, really helpful, and I've heard personal experience how somebody that might be living with schizophrenia might express that they didn't notice that their symptoms were acting up until a loved one pointed it out to them. Um, there's this part of schizophrenia that it's hard to kind of notice that you're experiencing it or identify that as the person. So that's why it's really helpful to have family involvement. So just also going back to negative symptoms, flat affect we discussed, experiencing less pleasure in everyday activities or activities that that person might ordinarily enjoy, speaking very little. So that's, again, the absence of the discussion, the speaking. There's also cognitive symptoms, trouble focusing, difficulty with memory, difficulty making decisions. I was doing a presentation probably at this point like a year ago with family members, and all the family members had loved ones, or I think mostly children, living with schizophrenia. And there was a common theme that came up over the course of the 5 weeks that we've had this series of presentations. It was the idea that my son, I just want him to take my medication. I don't understand why he doesn't remember. I tried to remind him, I just don't get it. It's not that that person is a bad person. It's not that that person is trying to be malicious and not trying to do something that might be helpful. It's also a part, or it's part of the diagnosis of schizophrenia, difficulty with memory, difficulty focusing. It's not that they're a bad person. It's something that it also helps us as, community members and family members to help identify and support along the way. And then just, highlighting again, the last point, medication and supportive treatments can help to manage symptoms, offer ways to cope, and support folks with individualized goals. So let's also dive a little bit deeper. So understanding your diagnosis. So just for everyone's background, I think they say at around age 22 is a common age where symptoms start presenting with somebody. Sometimes earlier, sometimes after. A lot of times, if somebody is starting to experience maybe hearing voices or other possible delusions, they might not even know that it has to do with their mental health. Why? Because people aren't in the community always talking about it or thinking about it, or in schools, we're not always talking about it. There's also instances where people try to express this to family members, to friends, but they might not understand either. Sometimes, especially in the beginning, somebody who is not connected to the world of mental health, they might think, "Oh, your child, you're experiencing something. It will probably go away soon. It's a moment." Um, but sometimes that's not the case, and it takes about 2 years after diagnosis for somebody. Oh, it takes about 2 years from somebody to start presenting to actually, say, meet with a doctor and have a diagnosis. So that's like around age 24, give or take. And then that person has the opportunity to, meet with a doctor and take medication and start on a journey of combining medication, hopefully, with everything else, and also knowledge, information, support, different programs, different resources, and a whole treatment team.
And
So,
Sean, we have a question here.
oh,
What is the
sure.
consensus these days on the relationship between having done drugs recreationally and the onset of schizophrenia? This person says, someone I know had the first onset after
Yeah.
doing some LSD many decades ago. And
Yeah.
today they are still dealing with schizophrenia, though controlled. He's not sure if it was the drug that caused it, or it might have been a latent schizophrenia that was triggered by the drug. What do you think?
I've heard that too. Sometimes psychosis, so we say, or symptoms present following some kind of use of or drugs and alcohol. That's actually kind of defined as a subsection of the diagnosis if you're speaking to any doctor specifically. Um, I have heard elements of that. There's still, research and I guess more to be discovered, but that is known to possibly trigger parts or different aspects of schizophrenia or a related disorder.
And one more question, Sean. You said that people get diagnosed around in their 20s.
Yes, more often than not, yeah.
Okay. So, for example, for pediatrics, are there any pediatrics that start presenting any symptoms of schizophrenia in early childhood? For example, these kids that have imaginary friends and they go to their imaginary friends. Like, is there any relationship between that kind of
Sure,
imagination,
sure.
maybe just seeing things that don't exist?
I guess I can't speak exactly to the relationship between an imaginary friend and what that might develop into or evolve into. But something that I can speak on is, part of my day to day is being out in the community at different programs. And in New York State, over the past just few years, there's been more of a development and effort on um, like a certain like youth program that helps manage mental health and also schizophrenia or related disorders. And I've spoken to treatment team members and staff in passing, not having the most in-depth conversation, but they are managing that from like I guess like adolescence. So there is a gray. I think in terms of medication, and I can't speak on all medication, but I know that there like some medications are approved starting at age 18,
Mm.
but there are early psychosis programs. So they say in New York State, there's a program called On Track that's scattered all over the state. If you ever come across that, would be like an early psychosis program. So for younger people, I guess anywhere from, I guess I don't know offhand, but around 18, maybe earlier to probably around 30. Because the earlier on in somebody's treatment journey, like if you take two people, somebody is age 20 and they start on medication versus somebody who finally starts on medication with schizophrenia at age 60. Early intervention, just like with many things around our health, as we know, is helpful. So like imagine somebody finding a medication that works for them at the very start, at the very beginning, how much hope that might lead to somebody that might not have several relapses or a wave of the symptoms returning at a later age before starting medication.
Yeah.
So there are programs out there that are working in that world of somebody that might be younger, maybe school age, teenage years, adolescence.
Mm-hmm. Now, I don't know if this is going to come later in your presentation, but they're asking this question here. Who will be part of the treatment team of schizophrenia?
Yeah. Let's wait. I'll talk about that in a moment. But that's a great question, and I'm glad that that's a thought because I want to also be very clear, and I'll expand on it. We call it a treatment team for a reason, not like a treatment person. It's good to have that. So I'll dive a little bit deeper in a moment.
Perfect. Okay, I'll let you continue.
So possible causes of schizophrenia: genetics, environmental, brain chemistry. So there's certainly a genetic component. Like, for example, I think there were studies, I guess, early on in research around schizophrenia comparing like twins that have very similar genetics, right? And the relationship between, like, if one twin might have schizophrenia, the likelihood of the other twin having is much, much higher than the general population. So there's certainly a genetic component. Environmental. When I think environmental, I think of community settings, like in the world. So if somebody is living in a community where they're exposed to traumatic moments or issues around like food insecurity, difficulties connecting with education and community support, poverty, that also might have an impact. In addition, when we think about the trauma that a veteran might experience in combat, certain elements of those traumatic moments could often be a precipitating factor, or there is a relationship of when that person comes back after the military as a civilian, that trauma is very, very real, and there is a relationship. Also, brain chemistry research has studied that there are certain brain chemicals that are linked to for somebody that has schizophrenia. Benefits of early treatment. So I actually touched on this a moment before. But early treatment, in other words, finding a treatment team, finding a doctor, finding medication, there's a best opportunity to achieve treatment goals, reduce likelihood of that person going to the hospital or hospitalization, minimizes the risk of relapse and delays functional impairment, reduction in possible symptom severity, and it promotes remission and recovery, or in other words, like a period of time where the symptoms are not intense, where sometimes, I've spoken to people that they have a great treatment team, they have a great medication, and it works for them. They still might hear some voices. However, the voices are far less intense than they were before they started the medication. And even though they might be there, they can kind of put it to the side, ignore, and live a daily life without being, I guess, severely impaired or distracted or scared of the symptoms. So like medication, just because somebody is on medication doesn't mean that everything will go away in its entirety. Sometimes they might, but starting on a medication earlier on really helps with all other aspects. That's why there's programs like early psychosis program, because there is an emphasis on discussing and providing intervention as early as we can. So this is a good snapshot of what a treatment team might entail. So I'll go through each of their roles, because again, it's a team, it's not just one person. When we think about a psychiatrist is a medical doctor that specializes in mental health. They're experts on medication for mental health. They often might be able to provide a diagnosis. There are certain, like, rules of thumb and assessments that they might do. A social worker, or also you see to the right of social worker therapist, they are at times interchangeable, is a kind of credential where somebody who is a social worker might function as possibly a therapist, but also maybe another role that's not a prescribing role. Just because there is a prescriber, a doctor in play that's important, it doesn't take away of the amazing impact that other supports might make. We also have underneath nurse practitioner. A nurse practitioner is another prescriber. I want to say like they're a nurse with an advanced degree that they're able to prescribe. If somebody you know is meeting with a nurse practitioner and somebody else that you know is meeting with a psychiatrist, it doesn't mean like, we think in the common zeitgeist by listening to the news or watching a movie that all prescribers are psychiatrists, but in today's day and age, nurse practitioners are phenomenal prescribers. There's many out there who specialize in mental health, and somebody might see a nurse practitioner for medication and this sort of diagnosis medical discussion. There's also a psychologist, which might be like a therapist or a social worker. Also, another credential versus, say, a social worker, but many similar roles. There's also what we call a case manager. A case manager is a little bit different. A case manager is a broad term, but that might be somebody that helps sort of with like certain paperwork that's important, or imagine somebody is coming out of the hospital and there's certain insurance things that needs to be worked on. That person might have a case manager that could help navigate a complex world that might be tough. A case manager might also be somebody that's sort of like hands-on, that might drive somebody or navigate in the community with someone from an appointment or maybe to the store or practice grocery shopping, whatever it might be. I also touched on therapist, pharmacist. People forget that they could go to their pharmacist when they pick up medication and have a medication discussion with their pharmacist. And some people identify their pharmacist as somebody that's really important to them. Here's a call out of what we call a peer specialist. What a peer specialist is, it's somebody who has lived experience living with mental health or possibly addiction, like substance use or drug use, that's literally been there, that could provide personal advice to somebody. This role of somebody as a peer specialist is truly phenomenal, because on one hand, having somebody who's a doctor or a therapist might be really, really helpful, but there's something different about talking to somebody who's done it before that could be maybe able to provide that feedback and that wisdom that really lands with somebody, especially somebody, we think about a doctor. Doctors could be great, but they could also be intimidating with their white coats and their big words and their big language, and they might be great, but there's also something around a personal connection of somebody that's been there that's different. The hierarchy sort of goes away. Also a nurse. So a nurse might be there to help with also medication stuff, but also overall health assessments. So this is a call out of a treatment team. I go to programs and there's possibly literally somebody or multiple people having all these roles. There might be a psychiatrist that's prescribing. There also might be a second prescriber who happens to be a nurse practitioner. There might be 3 social workers. There might be 1 nurse, 4 case managers, 2 peer specialists, and that's what we call a treatment team. And in the event that somebody has their therapist go on vacation, their therapist gets promoted, their therapist moves, I always like to highlight that if you're able and you're lucky enough to have a team at a program, there hopefully should be somebody else that you trust that you can turn to. They might function a little bit. They might have a therapist, and a peer specialist might have a different role. but it doesn't lead somebody to feel isolated, right? Any questions around this that somebody wants to ask or want me to clarify?
Not so far.
No? Okay. I think we do we end at 1, Sandra?
We can end up at 1, yes.
Okay.
But if there is something else that you want to discuss, I think that people are very interested on this topic, so I don't have
Okay. I'll keep my eye on the clock.
Thanks.
Let's move past a little bit. So I'll talk about this briefly. We already talked about it a bit. Supportive treatments versus medication. We'll talk about medications in a moment, but there's definitely support about everything else in somebody's life that's outside medication. Medication goes far, but it doesn't go everywhere. There's resources like supported employment or help with education. There's therapy, either one-on-one therapy that talk, psychotherapy, sometimes group therapy or family therapy, social skills training. So possibly somebody might attend a group and there might be a facilitator, a staff member, a treatment team member that is providing that advice about social skills and just navigating day-to-day life. And then other support groups. There's certainly NAMI. If anybody's not familiar with NAMI, that's like the #1 mental health support advocacy organization in the US. They're in every state and pretty much, I would imagine in every major or smaller city. When we think of like the American Heart Association, there's other areas where there's a focus. NAMI is that great focus for mental health. And I'm sure you can find it. You can do a quick Google search of NAMI in New York, and you can find a local chapter. They do a lot of great work. We also break down types of medication. So now we're leaning into more of like the medication piece. There's traditionally 2 kinds of ways that we have medication available. When we think initially, we think oral medication, so pills. Sometimes people take a pill for antipsychotic medication to help with everything. Once a day, maybe even more than 1 time a day. That's, very common, but there's also other ways that people can take medication, and sort of the field of mental health is starting to actually move towards this area. We call it long-acting medication. So these are medications that instead of taking it every single day or twice a day, it's usually given generally once a month, but they're sometimes a little bit more frequently or sometimes even less frequently than that. So imagine once a month is 12 times a year versus every single day. To have a medication that does a good job, a lot of people prefer that for obvious reasons. It's administered at different dosing intervals, so that's like the time given as an injection, usually by a nurse, but sometimes even a doctor or other folks might be able to provide it. It absorbs slowly into the body over time. So if you think about somebody taking their medication every day the medication has its effect. If you take a medication once a month through a long-acting medication, or in other words, an LAI, that it does its job through the month, and then when the month is time for the next time, it starts again. They get it the next month. And it's also helpful for somebody to know that they are every month at around the 15th of the month, for example. They're like, it's helpful to keep on track. And this is also different. Some people might be familiar with short-acting injectables. Those are like crisis medications, like given in an emergency situation, like an emergency room. This is different. This is like proactive, like an oral medication is proactive. I see a question. Which kinds of side effects these medication can cause in general? It does depend on the medication in itself. There's different names of medication out there on the market. Everything is also available like online, like it's disclosed. If you search up different antipsychotic medications if you're interested. Sometimes it's weight gain, that's common. There's also sexual side effects that might occur. Um, they're they the side effects of, say, medication from 30, 40 years ago, it's much it is much different. While that's not downplaying that side effects do exist, sometimes I've spoken to people that there may be a side effect, but there's actually a very common other medication that is like used to help manage that. And it's also important to note that even if there is a side effect that might possibly happen for some people, it doesn't mean that that will actually happen for you. It doesn't guarantee it. But I always suggest people to have that conversation or discussion with their doctor and their treatment team just to know what they might look out for. Because if, God forbid, there's a terrible side effects that occur, there's also possibly another medication that might help. But it's a matter of continuing that conversation. Some people stop taking their medication cold turkey because of a side effect, and that's something that no doctors want to happen. So I would always encourage somebody to connect with their treatment team, connect with their doctor, and be honest, and then have a plan to go off that medication and start on something else. But that's certainly a specific discussion that somebody might have with their doctor and treatment team. But good question. It's not lost on me that while medication, there's certainly pros to medication, people do experience some cons, and some of the cons have to do with the side effects. And that's something that people might work through along their treatment journey. Oh, just skipping along. So I'm just gonna we have two different case examples. So these are two fictional people, but I think it sets a good foundation of a lot of what we talked about. So as we're concluding today, this might help in our minds help us support somebody that might be managing something similar. So let's meet Dion. So question, how can Dion start and stay on track in his recovery following discharge from a hospital? So questions to think about. So Dion is a 21-year-old male. He's in college, he studies computer science, and he likes to play the guitar. He began having difficulty in school and was recently hospitalized and diagnosed with schizophrenia. How can Dion start and stay on track with his treatment plan so he can continue to pursue his goals? Dion is somebody who is young, he's in school, he has hobbies, he's studying. I would say that connection with appointments, connection with medication, possibly reaching out for support. Certain schools might have, and there's a good chance, have some kind of counseling center that might possibly be a resource for somebody like Dion. But I would imagine Dion wants to continue and complete his degree and exploring medications. Since he was recently hospitalized, he might have just started a journey around medication. So that might be something that he wants to explore with a possible new doctor that he might be referred to after he leaves the hospital, right? In addition, just another person, meet Ava. How can Ava prepare for her next doctor's appointment? So Ava is 24 years old and she's living with schizophrenia. She loves to draw, write poetry, and she works, which is fantastic. And this is just another call out that somebody might have a diagnosis of schizophrenia, but they certainly could work, do things like everything else. Therapy, family support, and medication are some of the strategies she uses to stay on track. However, lately, she's been noticing that some of her symptoms have increased in intensity, and she has also had some difficulty remembering to take her daily medication. but she has a doctor's appointment coming up. What can she do? She could prepare ahead of time for the appointment. I certainly know people that write down questions beforehand because it's so easy to have questions prepared in our mind and then go to the appointment and talk about the first, talk about the second, and then walk out without bringing up the third because it just wasn't top of mind. You were talking about other areas. So writing things down is certainly a tool that a lot of people use. Maybe even bringing somebody to the appointment, that could be a possible outcome. If she's somebody that is noticing that her symptoms are coming back, that's certainly something that she would want to express at the appointment. She can make a note of that before and bring it up. Also, sometimes I found sometimes people are embarrassed to, for whatever reason, to talk about it. But if you can write something down ahead of time, it might give us the confidence to read off of it at the appointment and not downplay it. Because I've certainly met people that said going in, they plan to talk about it, they want help, and then at the appointment, they see the white coat, they see the doctor, they think to themselves, I don't know, maybe it's not really a big deal. Like the voices aren't so bad. They were getting worse, but I think I could manage it. And then they walk out of the appointment and nothing changes, and then the voices go back even worse. So those are good strategies to help her stay on track with her recovery journey. So on that note, just to wrap up, let's put the pieces together. Take time to learn about your mental health condition. I would say with the help of your treatment team, we all certainly have the right to search the web, look up information online. I would just always caution that or take it with a grain of salt. You can search anything online and you might go down a rabbit hole of things that isn't helpful. So that's why it's extra important to have professionals in your corner that you can actually go to and have a personal discussion around it. Gain knowledge and understand what common symptoms that might occur. Build trust and connections, especially with your treatment team. Define your own personal recovery journey. Stay consistent with your medications. Stay consistent with appointments. Engage in other supportive treatments aside from medications that we've talked about. And establish a healthy routine. I think that's, I'm a big believer in that. And the idea around taking care of your personal life and personal goals in connection with remembering to take medication and going to appointments and doing things that feel good for ourselves is helpful along the journey. So on that note, I think we're at time. Are there any thoughts or any questions that I can help with from anybody?
Well, there are two follow-up questions, and thank you so much for this very comprehensive presentation. One of the questions is, how do you know when it's time to go to the ER, either for yourself or when it's time to take someone to the ER?
That's a great question. I'm glad you brought it up because I didn't talk about that. Something that I found sometimes in working with folks and hearing people's stories, there's been instances where people experience something that's stressful, whether it's a rise of symptoms or something else, and they feel they have to go to the doctor or better yet, go to the emergency room. So I'll never encourage somebody to just not go to the emergency room if they feel deep down that they need to. But I've spoken to people and maybe they were stressed, maybe something happened, then like everything else, the stress passes us. They come back and they report to me, I probably didn't need to go to the emergency room. I could have done better at taking a breath, working on my breathing. I forgot how much taking a walk helps me calm down, and I didn't do that. Instead, I went straight to the hospital. I probably should have decompressed and waited a day and thought about it a little bit more. But there are certainly times where if the symptoms come back, and they always say if you feel that you're a danger to yourself, you're having thoughts of suicide, You're having thoughts that you might want to do something that is very risky, and you might be close to making a plan to go out and do that, that would be a flag where it might be an emergency, it might be a crisis. We shouldn't wait for the crisis to escalate even further, or somebody else out there you're discussing, or you get that sense, or you feel that way. There might be a situation where you might be able to support that person through a tough time, but there might be an instance where a crisis intervention setting, a hospital. There's also something that we call respite. I don't think we have time to go over that, but what a respite program is, sort of like it's like a short-term stay away that's not a hospital, that there is support. Sometimes if somebody is in a living situation that's stressful and they're thinking to yourself, I wish I just had like 3 days where I could decompress. I don't want to move out. It's a lot right now. There are respite programs out there. I would just encourage to do a Google search in like what's local. That might be an opportunity that is before going to the hospital. I don't have like a cut and dry response. But certainly involving the treatment team, making a phone call to the therapist, calling your doctor, whatever it might be, that might be an option beforehand.
Can anxiety, like an anxiety attack, be
Anxiety attack, yeah.
with schizophrenia?
So I guess I could sometimes the voices or their symptoms in general could create a lot of stress or anxiety, and fear for that matter. Schizophrenia and anxiety are kind of two different diagnoses, but that's not to say that anybody, even if you don't have a diagnosis of an anxiety disorder, that you might not feel anxiety. But that certainly could, somebody might experience that stress, just like how anybody else. I spent most of today talking about schizophrenia, but it's also not lost on me, and I want to highlight that we all might experience something, but I imagine somebody that is experiencing a lot of other circumstances, like voices, what that might add to daily life stress and anxiety. So I would say there is certainly at least an indirect, possibly could be an indirect connection.
And the last question is, how do you know when a person is hearing something due to imagination versus hallucination? Like, what's the difference between imagination and hallucination? How do you recognize that?
I guess I don't have an exact answer, but just thinking off the top of my head, there's a difference. Somebody might hear voices, let's say, but it doesn't get away with anything that has to do with anything in their life. There is no, it doesn't affect daily living, it doesn't affect work, it doesn't affect school. There might be somebody else that hears voices that gets in the way, could be desperate, in an astounding way, or even somewhere in between. I would probably look at it as the spectrum of how much it interferes with day-to-day life.
Okay. Well, thank you so much
for
answering all those questions and for your presentation, Sean. I'm sure that we'll be gonna be calling you now that we know that you not just do a schizophrenia, but you are definitely a book of knowledge.
Oh, thank you.
Thank you so much for being with us today and for giving this information to our community. And please come for more community chats. Next week, we're talking about managing severe asthma. So if you have asthma or you have anyone who has asthma, we're going to learn more about asthma and how it works and how to treat it and all of that. So you're more than welcome to join us.
Thank you.
And I will see you next week. Thank you, everyone.
Thank you. Okay, bye everybody. Thank you so much for your time.